दम भरे दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना।
Good morning, all. Giving tribute to our master Samuel Hahnemann, who taught us dare to be wise. Taking blessings from our Guru, Dr. Prafull Vijayakar sir, who made this science very wonderful, bridging the old science with the modern science and made homeopathy is mathematics. Jai Hahnemann, Jai Homeopathy, Om Vijaykaraya Namah. So we are starting with the aphorism number 6 from the Organon of Medicine, Samuel Hahnemann, 6th edition. So in yesterday's session, we learned aphorism number 4 and 5. In 4, we have learned that he is likewise the preserver of the health if he knows what is to be cured in the disease and what is preventive in the disease. And in the 5th edition, we know that the most important cause in acute disease is exciting cause, and in chronic disease, it is a fundamental cause called as miasm. And to consider the miasm, Hahnemann sir says that you have to understand the moral, intellectual character, his habit, mode of living, etc. into considerations. So, the aphorism number 6. What Master Hahnemann told us that the unprejudiced observer, well aware of the futility of transcendental speculations which can receive no confirmation from experience, be his power of penetration ever so great, takes note of nothing in every individual disease except the change in the health of the body and of the mind, the morbid phenomena, accidents, or symptoms, which can be perceived externally by means of senses. That is to say, he noticed only the deviation from the former healthy state of now diseased individual. So, क्या बताया है सर ने? ये बताया है कि we need to take note of the change in the health of the body and the mind, and what are the morbid phenomena, accidents or symptoms our patient is expressing to us. कैसे पता चलेगा? So, now disease individual which are felt by the patient himself, जो patient ने experience किया है, तो patient बोलेगा कि this is my subjective feelings or subjective symptoms. Remark by those around him, यानी उसके relatives ने कोई observation किया है, जैसे you find that the person is having unconsciousness or person having collapse because of certain ailment. So patient cannot tell you the feelings or subjective symptoms, but the relatives or attendants tell you that he is doing like that and suddenly he developed these symptoms, he collapsed. So this is what remarked by those around him. And the last but not least, the observed by the physician. So physician has a very vigilant in his observation. So these three phenomena has to be. So these two things, consider that one is a subjective symptoms of the patient and the second is the objective symptoms by the relatives attendance, and the observations. All these perceptible sign and represent the disease in its whole extent. That is, together they form the true and only conceivable portrait of the disease. तो जब हमें ये symptoms मिल रहे हैं subjective and objective, so we need to find out the subjective and objective symptoms. We need to categorize into two things. One is the common symptoms of the disease, and one is the uncommon PQRS symptoms of the disease. So there are a certain subjective symptoms which is classified. Say, for example, patient having a acidity and patient says a burning. So the burning is the common symptoms of acidity. But patient is telling you that the burning is relieved by drinking a warm water. So this is something a subjective feeling that the patient is emulated by the warm. So that is the qualifying this as the PQRS. So you have to consider two things and that represent as a whole because it is a individual symptoms. It is not the disease symptoms. So something that give you a portrait of disease. Now what Master Hahnemann told in the footnote number 2, therefore I know not how it was possible for a physician at a sick bed to allow themselves to suppose that without most carefully attending to the symptoms and being guided by them in the treatment, they ought to seek and could discover only in the hidden unknown interior what there was to be cured in the disease, arrogantly and ludicrously pretending that they could, without paying much attention to the symptoms, discover the alteration that had occurred in the invisible interior and set it to the right with unknown medicines, and that such a procedure as this could alone be called as radical and rational treatment. So, in that para, what Master told about the old school of medicine, they understood disease as something is happening internally, but not know what it is actually. And they consider that this is something as the causative. For example, the gastritis, but they consider there is something that H. pylori infection is there. So they prescribe antibiotic for that. But this cannot relieve this. This called as a radical or rational treatment for that. Then is not that which is cognizable by the senses in the disease through the phenomena it displays, the disease itself in the eye of the physician, since he never can see the spiritual being that produced the disease, the vital force. Nor is it necessary that he should see it, but only that he should ascertain its morbid action in order that he may thereby be enabled to cure the disease. So, in that, what we have to understand these symptoms, it is something that is reflected outwardly because of there is an internal derangement of the vital force. So if we know that internal derangement in a proper sense, then we have to analyze and we have to cure that. So what allopathic physician do? What else will the old school search for in the hidden interior of the organism as the prima causa morbi, whilst they reject as the object of the cure and contemptuously despise the sensible and manifest representations of the disease, the symptoms that so plainly address themselves to us. What else do they wish to cure in the disease but this? So they consider only, see, the same example I'm giving you is the acidity example. They treat H. pylori as the cause of the acidity. But they don't know this man is suffering from the acidity because of certain stress and the conflict arising in their life, and that create the inflammatory disorders in the stomach. So the homeopathy can know that there is something beyond that, and that is the spiritual being is affected, and that spiritual vital force giving rise to the outward symptoms. So they just treat the infections by means of treating the H. pylori, while what homeopath treat the hidden interior something happening in the spiritual being. Hope you understand this aphorism in a proper way. Now we are continuing our theory of suppressions. So we have yesterday we have learned about the first layer, ectodermal origin. So today we are going to learn about the further. Yesterday we have learned about the first stage of the disease suppression. The second, now we are starting with the second stage of disease suppressions. So second stage of the disease suppression is ectoderm to the endoderm. So disease is said to be the second stage when the symptom manifest in the endodermal derivatives. The endodermal derivatives is like respiratory tract epithelium, GI epithelium, urinary tract epithelium, especially urinary bladder, epithelium of the gallbladder, and extrahepatic duct. Endodermal cells of the liver parenchyma. So these are the endodermal origin. And what happened in endodermal origin? The disease represent as rhinitis, pharyngitis, bronchitis, gastritis, acidity, aphthostomatitis, cystitis, leukorrhea, vaginitis, jaundice as viral hepatitis, and typhoid. So here the disturbances are in the functional element. It means the mucous membrane endothelium and not in the structural element or parenchyma. So here we have to understand that this is just the endothelial lining is affected, not the deeper parenchyma of the particular system is affected. So disease like pulmonary cox, atelectasis, chronic renal failure, which are associated with the parenchyma, do not come in this level. It is in the higher level. So sir has proposed certain age. See why sir has proposed certain age. This we learn in our the chapter of Mayasm, book of the Mayasm. Sir has made that the every individual travel from the Sora to syphilis. So sir has made the particular age. In a particular age, they suffer from the soric trait. In a particular age, they suffer from the psychotic trait, and in a particular age, they suffer from the syphilitic trait. But nowadays, the disease has advanced. So sometimes this age is no bar, and very young age the person may suffer from the psychotic or syphilitic state. But this is what Sir has made for our understanding, put into forth that Sir has put certain age into this. Children from the fun year of the to the teenage are more prone to the endodermal affections. Like the patient is now put it on the entimtat for the catarrh or as arsenic halb or blata orientalis as a bronchodilator. It is rare that the patient on such a treatment ever responds favorably. It is rare. Hence, the homeopathic physician advised to take help of bronchodilators like asthalin, some syrup, some tablet, theophylline, prednisolone combination, Ventolin, Decadron, or a pump when his headache is really bad. If the homeopath managed to relieve him with any such homeopathic medicine given 3 times a day or with a gradual increase in potency, he notes it down and publish it as his greatest achievement even though the patient himself say, I have no attack of breathless since last few days. But I find myself sort of breathe nowadays when I ascend staircases, which was not so before. So this is was very peculiar as you have to understand from the patient perspective. Patient says my asthmatic attack is getting better, but right now I find something weird that when I ascend, I find something something that is a short of breath. So this is something that which was not before. So I hardly have the will to get up in the morning, least of all to go for the work. So this is also something happening in the patient. Or all my joints aches. Or off late, I also get sometime a headache. So the patient is not going into the third stage of suppression. The patient is better in the second stage, but now the third stage has started. So third stage of suppressions of the disease. Now, disease is said to be in the third stage when the affection manifested in the mesenchyme derived from the mesodermal tissues. It means the connective tissues. The connective tissue, as the name suggests, act as a missing link or a connection between the endodermal epithelium and the mesodermal viscera. So this is the connections. So this layer consists of coverings and the somites. So the somites are of three types. So dermatomes, myotomes, and sclerotomes. Dermatome gives rise to the dermis, the outermost. Myotome gives rise to the muscles and intermediate, and the sclerotome gives rise to bones and cartilage, the innermost. So here also, whenever you are prescribing certain medicine, the bone pain and cartilage pain has been gone to the muscles and from muscle to the dermis. So this is what a reversal. Whenever you are treating something like a psoriasis and patient develop arthritic pain, that again psoriatic arthritis, it's the complications of psoriasis. But again, this dermatome has been shifted disease from dermatome to myotome and from myotome to the sclerotome. So this is very important that in the categories. Along with this, the fascia, tendons, the aponeurosis, cartilage, bursa, joints, etc. are lining mesothelium. So what is the disease associated with this layer? The disease associated with these layers are the psoriasis, alopecia. Yesterday we have learned. So hair fall and external hair is ectodermal origin, whereas the root of the hair, it is the dermis. So it is alopecia is in the dermis. Myositis, rheumatism of the muscles, tendinitis, rheumatism of the joint, bursitis, inflammations of the cartilage, and the cartilage of the larynx producing the hoarseness of the voice, cartilage of the spine producing the lumbar, sacral or cervical spondylitis. So sir proposed that the certain age are prone to this type of disease, like the 20 to 40 years of the middle-aged people are prone to the third layer affection. A female patient comes to you in the early 30s, like 28, 29 years after a marriage, she developed that, she told us that there is a backache, and the backache start after my marriage, and the symptoms started. So when you investigate, it is you are finding that the lumbar spondylosis. So this is something happening. The patient's backache and joint being the better, he start complaining of the headache, breathlessness on exertions, and palpitations. These are short signs that the patient is now going in for hypertension. So after measuring BP, he is labeled as hypertensive and told category that he is now to accept that he is a potential heart patient and has to be dependent on some allopathic antihypertensive medicine. The patient has now entered into the fourth stage of suppression. So most of time, whenever you are treating a arthritic patient, bear in mind if the meeting will end, we will continue again. So join again. If the patient having the arthritis and you are treating them and the patient develop the headache, every time the patient visit you, just measure the blood pressure and you found that the blood pressure is rising. That is the sign that the patient may end up with the suppression. So bear in mind, keep your eyes open because psychosis is a slow progressing process in the body. When inflammation gets suppressed, it went into the chronic inflammation, the psychosis, and this psychosis leading to a cheating. So law of psychosis is cheat everyone. So even they cheat the doctor also. So you don't understand what is happening in the interior of the man. But when you measure something, you found that this is because of hypertension. So keep in mind, bear this. Now, the fourth stage of the disease suppression. So, disease is said to have reached the progress to the fourth layer when the affections start manifesting in the mesodermal derivatives. See, these are both are the mesodermal derivatives, the third layer and the fourth layer. The third layer consists of the mesenchyme and fourth layer is mesodermal organs. So mesodermal derivatives like lung parenchyma, kidney, muscles which forms the trachea and angioblastic tissue. So angioblastic tissue giving rise to the blood vessel, heart and blood cells. These all are from the mesenchyme, but it is a higher in version. So it was put into the fourth stage. Beside this, all the viscera coverings like the pleura, peritoneum, pericardium, dura mater, pia mater, spleen, liver, capsules, and fibrous tissues are put into this mesodermal derivatives because this covering is protecting the major organs. So disease associated with this is the tuberculosis, nephritis, hypertension, atherosclerosis, piles, varices, varicose vein, ischemic heart disease, producing infarct, thrombophlebitis, lymphangitis, cirrhosis of liver, pleurisy, pericarditis, and peritonitis. So sir proposed a particular age, and when you read the medicine book, you can found that this age, this disease are prone to be in the middle-aged people. So most of time it was written in medicine book also. So at the age of 30 to 50 years, they develop this kind of disorders. The patient who is put on specific treatment of above complex, for example, the patient having a cardiac weak, so they prescribe a cardiac tonic, or a patient having hypertension, so they prescribe the antihypertensive or on a combined allopathic and homeopathic treatment. So they gradually develop diabetes and thyroid problem. Most of time it was seen that the doctor advised that now you are labeled as cardiac patients or hypertensive patients. They put on certain medication, and after 1 or 2 years or 3 years, their sugar got shoot up, and this shoot up of the sugar giving rise to a diagnosis that now you are labeled as a diabetes. For some time, the dysfunctions at the thyroid level, the patient is putting on weight, a weakness is going on, and that is considered to be a higher version of the layer is suppressed. So fourth layer goes into the fifth layer. Then the fifth stage of disease, suppression. The disease is said to have progressed to the fifth stage when the affection manifests due to the impairment of the functioning of the neuroendocrine system and APUD system. APUD stands for amine precursor uptake and decarboxylation system. These are isolated group of the hormone secreting cells, not restricted to the endocrine gland only. There are two type of gland. One is the endocrine gland, one is the exocrine gland. So they are widely scattered in many tissues. Okay, they synthesize peptides and which act as hormones and neurotransmitters. So whenever the affection of the hormones, affection of the neurotransmitters, affections of the peptide, it is there in the fifth stage of disease. So they classify into one, the neural crest origin. See, whenever you understand the embryology, there is one thing is the neuroectoderm and the neural crest origin. So neural crest origin means the affections of the thyroid and adrenal medulla which are there in the neural crest. So they secreting the adrenaline and noradrenaline, and in the thyroid it secretes the thyroxine. In the dermis, there is a melanoblast which also having a neural crest origin, stimulated by melanocyte stimulating hormone. In the urogenital tract, secreting the 5-hydroxytryptamine. This is also a neural crest in origin. And the second is a neuroectodermal origin. So neuroectodermal origin APUD cells means the affections of the hypothalamus, parathyroids, pituitaries, means which we called as HPO axis. Okay, HPA axis. So hypothalamus, parathyroid, pituitary giving rise to oxytocin, vasopressin, thyrotropin releasing factor, etc. So APUD cells of the disputed origins means the affections of the pancreas. See, this is the exocrine gland, pancreas. Okay. So pancreas having a islet of Langerhans cells secreting insulin, producing diabetes. Even there is one cell, beta alpha cells, which secrete the glucagon, which is for the management of the sugar. Enkephalin, motilin, cholecystokinin, neurotensin, secretin, and atrial nucleatic factors. All are not there in the brain, but they are into the system. So they are secreting, and when there is a change in this biochemistry, that giving rise to a fifth layer disease. So disease like a diabetes, leukoderma, thyroid, etc. come in this stage of the disease. Mostly it is found that this are the disease are found at the age of 40 plus years. This is what written in medicine book. Okay. Now The sixth stage of the disease separations. Here, the disease or impaired functioning progress to the nervous system. So first the sympathetic or peripheral nervous system and then the central nervous system is affected. See what very beautiful our body is trying to save the whole. So first the lower part is affected and then the higher version is affected. So this is what also in the nervous system also. So first the sympathetic system is affected, then the peripheral nervous, then the central nervous system, and these are the neuroectodermal in origin. So disease like the peripheral neuritis, neural deficits, hemiplegias, infarct, cerebral toxemias, confused behavior, stupor, comas, vertigos, neuralgias, all belong to this character. So you have seen that when the patient came to you with complaint of the backache, the patient says that the journey of the disease, there is a backache. I took some medicines, and after that, a few years, I diagnosed that there is a hypertension. So I took antihypertensive medicines. After that, 2 years, I diagnosed with the diabetes, and the patient having put on the anti-diabetic medications. And the patient is taking anti-diabetic medicines in 3 4 years, and now the patient is complaining there is a numbness in my periphery, a numbness in the foods and soles. So this giving rise to doctor says that it is a peripheral neuropathy, and that neuropathy because of diabetes. So this is what the progression of disease from backache to the neuropathy, the sixth layer. The seventh stage of disease separations, sir proposed that sir is categorized the last and the most important stage of mind. This mind is not actually the emotional mind. Okay, this is the mind of the cell only. So as already clarified, the mind does not mean the emotion of the love, hate, fear, fright, anxiety, anger, etc. It is not like that. The every cell is supposed to have a mind, and this mind is encoded in the genes, and it is called as a genetic code. So whenever the we develop from the unicellular mechanism, unicellular amoeba to this the complex cells, our genes having a memory and having a certain code which giving rise to a specific functions, and that functions is encoded into each and every cells. And initially, it is called as the organ brain, but it is not the organ brain, it is the mind of the cell. So this genetic code is same in all cells and thus impart character to the individual as a whole. Every cell is supposed to have a mind, and this mind is encoded in the genes, and it is called as a genetic code. This genetic code is same in all the cells and thus impart a character to the individual as a whole. The genetic code is essentially composed of two parts. One is called as acquired and one is basic. The code which is acquired or inherited from the parents and is specific to the species. Okay. The second is the code which is the basic code. The basic code is the code which has characteristic which every cell possesses, whether human, plant, or animal has to have. It represents the code from functions which every cell has to perform. For example, the cell has three functions only. One is the maintaining the homeostasis, second is the propagation, and the third is the defense mechanism. Okay, so to defend, the homeostasis comprises of the functions which are necessary for the cell and individual to live. So I have to balance, and it includes the functions of respiration, ingestions, digestions, excretion of which are controlled and governed by the normal working and normal secretions by physio-neuroendocrinal mechanism or control system. So when you understand the evolution of the brain, so you can understand the first is the midbrain and pons and medulla is developed, and there is a center of the respiration, center of the digestion, center of the excretions are there. So this is the old brain, which called as old brain, which include these functions, function to maintain the homeostasis, and it is controlled by the physio-neuroendocrinal mechanism. And this is so when these disturbances of this function lead to the tendency to disturbances in the functioning of the organ and system. So whenever we understand the functions is impaired, of particular system or particular organ, then this trait is called as a soric trait. These are the functional disorders. So disturbances at the level of organ which produce the functional impairment of the organ, whereas the disturbances at the limbic or neuroendocrinal level produce or reduce certain neurotransmitters or hormones like the adrenaline, epinephrine, etc. to produce intense emotions typical to the soric state. So most of the emotions is because of the change in the limbic system, neuroendocrinal chemistry, biochemistry, and this leading to the intense emotions. So all emotions are there in soric state. Okay. The second functions is of a defense mechanism. The defense mechanism function to protect the cells and individual from the external harmful agents. So this also contribute to the homeostasis. Again, all these three functions are to maintain the homeostasis only. So the predominant tendency to the impairment of the defense lead to injury to the organs and the tissue and hence simulate the syphilitic trait. That means what? If I have to defend myself, but my defense system is not working, so I am injuring myself and that's lead to the destructions of either a organ or particular part and that is simulating the syphilitic trait. So the destructive tendency along with its effect on the organism implies syphilitic miasm, which in turn is a flaw in the defense functions of the cell. Now, the functions of the cell propagations of every cell is very characteristic. Every cell has a code to multiply only into two daughter cells. See, every cell has given a particular functions, and that function is to multiply. So we grow from the a single cell ovum and spermate, and after that it grows into a big baby, and from deliver baby to big adult. So this is what the functions of propagation is going on. But if it is in a normal 1 to 2 cell, then it is a normal physiological mitosis is going on. But what happen if this code is disturbed? So multiple reproductions of the more than 3, 4, 8, and 10 cell take place, resulting in overgrowth. So from one cell, the 4 cells, 8 cells, or 10 cells is growing. So this is called as overgrowth. This tendency, with its resulting effect on the organism, are called as a psychosis or psychotic trait. So you have to understand what is the mind of the cell. So mind of the cells means any cellular mechanism happening at the body, which is what? Either it is a constructive defense, either it is a destructive defense, or either it is maintaining the physiology by balancing the neurobiochemistry. So you have to differentiate these three things into this, and according to that, we have to understand these are nothing but the trait which was there in the genes, and this trait is nothing but what Master Hahnemann has said that it is a miasm. So when disease reaches the seventh stage, and there is a massive disturbances in the functioning of the limbic system, means the emotional system, it produce disturbances like schizophrenia, obsessive compulsive psychosis, and insanity. So this is something called as out of control. So there is a loss of control. So this is means the code has disturbed, code has change. It is not just a schizophrenia is not like that physiological disturbance. It comes and goes. It become normal. Schizophrenia is a chronic process. So this is what the destruction of the genetic code at the level of mind or limbic system. If the disease reaches the seventh stage to completely destroy the code of defense mechanism, if the defense mechanism is destroyed, so it gives rise to injury. So injury which is inseparable, resulting in disease like destruction of the particular part or a particular organ or a particular system. So for example, a disease like gangrene, disease like Parkinson's, disease like motor neuron disease, disseminated sclerosis, we call as multiple sclerosis, or complete destructions of the island of Langerhans. So patient came to you with the complaint that insulin dependent diabetes. It is a complete destruction of the islet of Langerhans and Alzheimer's disease. So Alzheimer disease means there is a brain parenchyma as fault and the brain parenchyma is going to destroy it. Mostly it happen in the olden age. When the disease reaches the seventh layer in persons having predominantly psychotic trait, it produces a disease like a growth, like a cancer, fibroids, atherosclerosis, and its complications. So cancer has been two variant. One is the growth cancer, proliferations and multiplication, and one cancer having a ulceration. Okay, but both are at the level of genetic code. It is disturbed, and the defense mechanism is disturbed, so it produces disease like this. So these are the seventh layer disease. So we conclude this here, but we have to point the note from this seventh step. So point to note, so disease symptoms in the lower third layer can easily be removed by any homeopath prescribing on the particulars or PQRS or with specific mixtures or multiple doses can show impressive result in skin eczema, boils, ringworm, first stage, or rhinitis, bronchitis, diarrhea, urinary tract infection belong to the second stage, or the sciatica and joint pain, alopecia, the third stage. Very, very important. The disease symptoms of the fourth and fifth stage can be sporadically or accidentally removed by the wrong practitioners. So keep in mind, if you have to treat the higher disease, you need to be very precise. Okay. The partial similimum prescriber who take into account the mind axis but not the totality can only partially ameliorate the disease symptoms in the fourth and fifth stage. This stage include disease like the hypertension, ischemia, diabetes, thyroid. They run a risk of suppressing the disease to the higher stage. They require higher and higher potency to slow down the symptoms with a gradually decreasing interval at which they need to repeat. This indicates suppression. Disease of the fourth, fifth, and sixth stage cannot be seen ameliorated by the wrong or specific prescribers. Okay. So whenever the patient comes to you with the neuropathy and you prescribe any neuropathic drug, it cannot relieve. So you have to treat the individuals. Okay. Lower stage disease symptoms are a result of dynamic disturbances in the biochemical reactions, which can be altered easily either way. Higher stage disease symptoms are brought about by deviations of the genetic code. At this stage, say a gene is depressed, which synthesizes protein which alter the lipid metabolism to create a hypercholesterolemia, or depress a gene which alter the synthesis of the protein to alter the blood biochemistry to create the atherosclerosis in the cardiac vessels and the cerebral vessels. Such tendency cannot be eradicated without affecting the change at the genetic level. This can be done by the homeopaths who are not extremists, means those who do not prescribe only for the body or only for the mind. They have to be holistic and prescribe for the totality to get the cure as per law of cure. Cancer, schizophrenia, and malaria can never be cured or even emulated by the extremists, those who take only mentals or only physicals. Disease progression can be in one, two, or three currents. For example, a lady having a backache proceeds to have a diabetes and further goes into Parkinson's. Here, the disease has progressed from the third layer to the fifth layer to the seventh layer. After a few years, she develops backache again, which further proceed to the acute ischemic heart disease with a massive atherosclerosis. It is needless to say that she will proceed further into cerebral ischemia. Again, the disease progressed from the third layer to the fourth layer. The difference between the two currents was the first one was destructive. First one was destructive. That means the destructions at the level of nervous system, destruction at the level of pancreas. Okay. And the difference between the two current was the first one was destructive or syphilitic current, destroying the islet of Langerhans and pylori and to give rise to permanent diabetes, and later destroying the nerve cell to give rise to Parkinson's disease permanently. At first, syphilitic current expressed itself. Later, the psychotic miasm came to fore after a few years to give rise to the atherosclerosis. This gives us a clue to the drug which should be her genetic constitutional similarium. So we need to treat the things which is happening in the body. That means the person is in a two miasm or complex miasm called as psychosyphilitic miasm. So we need to prescribe a drug having a both tendency, that predominantly the syphilitic and psychotic tendency. So for example, Oramet and phosphorus. This was the SIRS example. Okay. Chickenpox, smallpox, measles, herpes have the direction of expression on the body which is exactly opposite that of other common ectodermal disease. An eczema or dermatitis when appearing on the body travel from outside in, from extremity to trunk, and when getting cured reduce from inside out, from trunk to extremity. This is what the eczema and dermatitis. Whereas in case of chickenpox, smallpox, measles, and herpes, the direction appear to in the form of center to periphery. It means from the trunk to the extremity. This is mainly because this viral disease is expressed on the skin only when the body is trying to cure the infection. It is more in the form of exteriorization of the toxin. Hence, initially, it formed the enanthema. Enanthema is means the toxin is traveling from the endodermal origin to followed by exanthema. So the egg of chordata in the early days of development shows this was in the embryology. A ream of the cell developed. This ream of the cell further divided into ectoderm, endoderm, and mesoderm. So the three layer germ layer is made. The three germ layer, the notochord and the neural plate, which again is continue with the ectoderm. So notochord and neural plate is connecting with the ectoderm. The brain, nervous system, and the spinal cord are actually developed from the neuroectoderm. It is a specialized ectoderm only, and not only neural plate as the chart may suggest. This in keeping with the roundness of the egg, hence the continuity from ectoderm to endoderm to mesoderm is maintained even from neuroectoderm to the ectoderm, as egg is round. So this is what you have to understand the circle. From the left corner at 9 o'clock, put the ectoderm. At 6 o'clock, put the endoderm. At 3 o'clock, put the mesoderm. And at 12 o'clock, put the neuroectoderm. Again, neuroectoderm is connected to 9 o'clock ectoderm. So this is what the round, this is what egg. So significance, what is the significance of this? The significance, the growth axis about 4 in number represent growth and the gradient of the fluid supplied from the neuroderm to mesoendo and ecto in a clockwise direction. So at 12, neuroectoderm to mesoderm at 3 o'clock to endoderm at 6 o'clock and ectoderm at 9 o'clock. So this is what clockwise direction. One axis also come from neuro to ectoderm. That means a reverse direction indicated in the picture, anti-clockwise from 12 o'clock to the 9 o'clock. All these growth axes are curative axis. The toxins are thrown out from either neuro to meso to endo to ecto in a clockwise manner or neuro to ecto in anti-clockwise manner. Thus, the disease are cured by the body itself in either of these directions. All disease follow clockwise directions of cure except viral disease like herpes, chickenpox, smallpox. They are essentially neuroectodermal disease. Body is trying to throw out the toxins of this disease or cure the infection as it represented by the following fact. So in measles or chickenpox, enanthema is followed by exanthema. It means the eruption inside mouth come first and skin eruption follow. Opposite of all other disease where the skin is affected first and endoderm later. Hope you got this point. This disease spread from center to periphery and up downward, whereas all other skin disease spread from down upward and periphery to center. Cure should take place as usual from the up downward or center to periphery. Here, in these cases, it happens to be also the direction of appearance of the disease. So in measles also, first enanthema jayega, फिर exanthema jayega. So that is what it is. Receding of eruptions or exanthema leads straight to the neuroectodermal derivatives of the brain and nerve cell, resulting into disease like SSP or any other encephalitis if patient is cuprum mat or zincum mat. This is what provided by the Sir's tip. So whenever you find that the measles goes into complications of subsclerosing panencephalitis, this is something that suppressions of the ectodermal eruptions goes into enanthema, goes into neuroectoderm, and it produces inflammation at the level of brain. So this is what something we have understood in our materia medica, that the eruptions on the skin goes leading to the nervous affections or the convulsion and spasm. So we have the remedy like cupramate and zincumate. This is the tip from the sir. Enanthema or coplic spot appear only on roof of mouth or palate. This is significant. This part is only part where the neuroectoderm and ectoderm are in direct connection with each other. Remember, the palate is from the ectoderm. This is the only place in the body where the mesoderm does not come between the ectoderm and neuroectoderm. Hence, the patient develop measles, chickenpox, etc. No medicine is the best simillimum. This is what Sir has advised. Just wait and watch the body cure itself. So in our olden practice also, many a time in we have heard in our from our ancestors that do not treat measles. They consider this is something that it is a curse of the goddess. So it is called as a Mataji or Maharaj or something else is the name of that. And do not treat. They put the person into isolation for the 7 days, kept in the neem leaves, and let the eruptions flows out. So this is what the olden people knows about, that this is what the body is curing itself. The virus is coming out. Of course, a sharp watch should be kept to observe the disappearance of the lesion. If any untoward direction is being followed, this is very important. Being unfollowed, it indicates a weakening of the body force of the cure, and the homeopath has to intervene immediately, not with an acute or specific, but with the right simillimum. So here, very specific, sir has mentioned, you have to prescribe the constitutional remedy only. The seven layer is almost the point of no return, but cure can still take place of the disease at this level, and here the definition of cure has to be understood. Cure here implies restoration of near to normal function with the sensation of the well-being leading to peaceful and prolonged existence in spite and despite the pathology. This can be achieved only by homeopath prescribing on totality. For example, a 4 years old boy, a patient of mitral valve prolapse, slated for immediate operation, open heart surgery, was treated with his constitutional simillimum, which was phosphorus. The boy who, complaining of breathlessness on slightest effort of wailing, ascending stair, etc., gradually within 2 weeks' time showed remarkable improvement in the stamina, and after a repetition of hardly 3 doses over a period of 1 year, could sustain an effort of carrying 10 kg of the weight up a staircase to the sixth floor of a building regularly, as he was a carpenter. Even as on today, after 8 years of no other medication, he is working really hard for living without any complaint. But his echocardiogram, the color Doppler, and all other investigation for the heart shows he still has the same old prolapsed mitral valve. His murmur also stays. For an allopathic physician, he is still diseased, but for homeopathic physician, he is compensated to call himself a cured. So this is what compensatory cure. So we have concluded our today's chapter here, and we are ahead of our time. So we will keep the question answer session tomorrow. Read this chapter from the book, and if you have any questions, we will have question answer session tomorrow. Hope you got this. This is a very important chapter for understanding. Any questions? We will have almost 5 minutes and we will end our session today. So if you have any question, put your question into chat box. We will discuss for 5 minutes only. A remaining question we will discuss tomorrow or day after tomorrow. Hope I hope you will go home, read, and then we will have a question and answer session tomorrow. So we will concluding this session today. Thank you for joining, and thank you all for the learning. Thank you. Thank you, sir. JJ Patel, sir, with us. Thank you. Sir, unmute your mic, sir. The voice is not audible. Thank you, sir. We will conclude this. Thank you. Thank you.